This is Samantha Lishak with Absolute EHS. Today we are doing an interview on behalf of Mama's Comfort Camp with, of course, the wonderful Yael Saar and Samantha Hillson of Tompkins County Health Department. So Yael is going to lead this interview and I will be here if there's anything you need from me. Take it away.
Thank you so much, Sam. Okay, it's a Sam and Sam situation, so I will be addressing Samantha Lushtak of Absolute EHS as Sam and Samantha Hillson of the Tompkins County Health Department as Samantha. Does this make sense to everyone?
Perfect.
Okay. So first of all, it is such a pleasure to be with you, my friend. Samantha and Sam and I are all good friends, although since COVID, we haven't seen each other in person. We do get to see each other regularly online in a special, wonderful space that is the Mama's Comfort Camp Den Mothers, which is a space where moderators of Mama's Comfort Camp and board members of Mama's Comfort Camp get to communicate sort of behind the scene of our mother support network, where thousands of mothers from around the world and across the street support each other in a very sweet and unique environment where we value needs over expectations and really try to be there for each other based on what we tell each other we want and need. So Mama's Comfort Camp functions because of the loving moderation that it has, and we are a nonprofit project of the Center for Transformative Action, which is based here in Ithaca and is an affiliate of Cornell University, and therefore we have an advisory board, and it is wonderful to have Samantha Hillson on our advisory board and provide her own wisdom as well as often the views and information available from the health department. So I could not be more grateful to have both of your intellects, huge hearts, and the unique knowledge that you bring as part of the Mama's Comfort Camp leadership team. So thank you. And it is just a treat to be able to go directly to you, Sam, right now, who in a way is a behind the scenes, like you're a mover and a shaker right now, because one of your daily roles is updating the local numbers of COVID infections and people getting better. And so many members of our community, and at least two members of my family, my husband and my teenager, check your input daily around the time that you put it out there. So you are providing a service that meets a need for so many people. And then there are those of us who would rather not know in real time, which is kind of me. And I trust that the people who care will find out, will let me know what I need to know. But I am just so, I'm in awe of the effective way that Tompkins County Health Department has been very transparent with our community about what's going on. And I'm very grateful for your particular role in it. So other than being the person who posts the data, if you don't mind explaining, what your role is in the health department and, your title and that sort of thing.
Sure. Well, thank you so much, Yael, for having me on, and Sam for hosting. It's really a pleasure to be with you and to take this time to speak with you. So my position at the health department is Director of Health Promotion. And for the past 10 months, however, I've been solely serving as the Public Information Officer for the health department, which was also part of my responsibility prior to COVID, but it was a pretty limited piece of my position. And that with the pandemic, it has really increased tremendously to be really solely focused on communicating information about COVID-19 and other relevant issues to the public, to our entire county. So that's been that's been what I've been doing. And it's been in partnership with a team of people that we have a communications team or a public information team at the health department as part of the Emergency Operations Center for the pandemic response. And so that was set up at the beginning of March. And that team is comprised of a colleague of mine at the health department who really manages and updates the website. It's composed of some individuals who we borrowed from other departments, that we have somebody, a fellow mama who works at Youth Services and the Workforce Advisory Board. And then we also have an individual from the planning department who works with us. And we have our communications director for Tompkins County, Dominic Recchio, who
I love Dominic. He's such a powerful force of good for good. Shout out to Dominic.
Yeah, shout out to Dominic, thanking him for all he's done to transform communication in our county. So we have a team. We have there have been other county employees who have come in and out of our communications team. Another fellow mama who works at County Office for the Aging and has just been doing tremendous work for our contact tracing team and for our communications. So we really, it is a team effort that, I send out a lot of the press releases that go to our local media and a lot of our social media, but so my name's on there, but it's really a team effort.
Nothing good can happen without a team effort, right? We know that. So I'm grateful for the team and I'm grateful for you. Okay, I will be expressing gratitude a lot because I'm so moved by, how, and that's when I lose my words. Okay. So let's for a moment get a picture of your personal life, because you're a mama to Alma. Am I pronouncing her name correctly?
Yeah.
And how has it been juggling all of your responsibilities at work, which are clearly bigger and heavier than they used to be before COVID, while handling a small child through a pandemic?
So it's been interesting and challenging and exciting all at the same time. I think it's, I'm so thankful to have a little person in my life. I mean, she is definitely keeps us going every day and brings laughter and joy and fun to our lives, and moments where I have to take a break and there's nothing else I can do but sit on the couch and read a story to her. And I think that I'm, again, just so thankful to have her, because it's really helped me and my husband get through this really difficult time when we haven't been able to see family and, close friends. And I've also realized that sometimes I wish she had a sibling, because
right,
she could be occupied a bit more sometimes too.
How old is Alma, and what does she do for schooling if she's old enough for that?
Alma just turned 5.
Happy birthday.
Yeah, she was very exciting. She's very excited and proud to be 5. And she does go to full-time daycare. That she was doing that prior to COVID, and then during the shutdown she was home, but then I did put her back in daycare in May, and it has been going great, and she loves being there with other children, and I'm very thankful for us being able to have her in daycare.
Hallelujah for childcare.
Yeah,
I have 2 teenagers that are schooling from home, and it is just so challenging. Not only navigating their own are you on the right meet, and are you quiet enough for the other person to hear their own meeting? But also just the fact that I'm never alone anymore. I used to work from home while my family went to school and my husband went to work. And I have not been alone for 9 months, which, is an entire pregnancy. um, so my own nervous system is discovering my inner introvert. I never knew I had an introvert. As you know me, I'm pretty, I'm so friendly. I considered myself a 100% extrovert. And turns out that I desperately need my alone time. And not getting it has taken a real toll on my nervous system and on my capacity to manage mental health conditions that I have, which is I'm a person with anxiety and depression, but it's been well managed for a good 10 years. So, these days I'm feeling my mental health conditions, and I'm a functional depressed person these days. So instead of being in bed crying, which used to be how my depression manifests, now I sometimes cry into the dishes or the meals that I'm cooking. But I'm definitely, recognizing that right now my depression is not a failure of mine, but just a normal reaction to an extremely challenging situation. So generating a degree of comfort with, okay, so I feel bad. That doesn't mean that things are bad. There's a lot of things that are bad in the world right now on almost every front, but therefore me feeling bad is not a bad thing. So we just need to manage how do we get through times when we feel bad? And that means educating my husband and sons that they don't have to come to my rescue every time they see me teary, and that doesn't make them bad family members. So it's all super complex and challenging, but in a way, I think the normalizing of, okay, so my feelings are not good, but feelings are not facts, and navigating how we support each other in a way that respects where we're at instead of trying to fix each other means that right now in my home, I'm actually walking the talk of Mama's Comfort Camp. So it's an interesting, the pandemic is, for those of us who stay at home because of it, ends up bringing different aspects of our work into our family life.
Mm-hmm. Yeah, definitely. And the, mental health challenges were definitely present before COVID, but I think that many individuals who anxiety, depression, different mental health issues might have been, more concealed in them, that they may be experiencing these kinds of feelings or, having these kinds of issues for the first time too, because of
absolutely
all that we've collectively been going through over the past many months of, being more isolated and not having those networks that we may have had previously. And it's so important for what you just spoke about, and for us to have it be present and have conversations about it in the community, and for people to be kind to themselves, but also, reach out for help, even if they've never had to do that before. That I think that is really important for people to understand that and it not just mental health issues, food security kinds of issues, housing issues. There are any
domestic violence.
Think about many different things that may not have been so in the forefront as an issue and a challenge for people prior to COVID, but is now.
Is the health department an agency that follows these things, tracks these trends, and promotes access to help, or would that be a different agency in the in the Tompkins County government that would follow these things?
Yeah, I mean, I think there are a bunch of local departments and agencies who do work very closely with the pulse on mental health in our community. The state health department tracks a lot of this, but locally, the health department we're actually officially one organization with the mental health department. So I have my colleagues at the mental health building on Green Street, and then Department of Social Services is also in the county and paying attention to many of these issues. And then we have some great nonprofits and partners in the community who Mental Health Association, who keep track of this too.
So after this call, we're going to post some links for people who are, noticing that maybe they should get some help. We're going to post these links with the podcast episode.
Mm-hmm. Great.
So things just got really exciting recently with the vaccines becoming available, and the health department is the agency responsible for distributing those. Am I correct?
So we are administering vaccine in partnership with Cayuga Health System. So Cayuga Health System has stepped up throughout the pandemic, starting with setting up a large-scale sampling site at the mall, and now we have one downtown as well. And so they partnered with us early on, and have really been committed to providing that service to the community. And now they are really taking the lead in administering the COVID-19 vaccine, also at the mall site at the Old Sears building. And again, it's in close partnership with the health department and our public health director.
When you say Cayuga Health Systems, how is that different from the Cayuga Medical Center, our local hospital?
So Cayuga Health System, I'm probably not the best person to define what their full organization title is, but I understand Cayuga Health System to include Cayuga Medical Center, the hospital, and Cayuga Health Partners, which is they are a network of providers in the community. And then Cayuga Health System branches, beyond our county as well, to some of our neighboring counties where they have facilities and provide service. So,
Great.
they're not totally defined to our geographic boundaries of our county. Which is why throughout the pandemic also that the sampling site for testing and the vaccine site as well they don't have residency restrictions, that they are open and available to folks who live in other counties who may come to our county
And qualify based on the state guidelines.
Yes.
Okay, so let's talk practically about vaccines for a minute. And in Mama's Comfort Camp, vaccines are actually a hot potato topic that we don't allow discussions in our Facebook groups, because whether to vaccine or not seems to be something that people cannot really convince each other in a friendly manner. So we don't discuss these things in our support network, and we recommend that people find better avenues. For the sake of this particular conversation, we are assuming that the people who want to get vaccinated want to get information, and therefore, going forward, we will be talking about how to get the vaccines, should you want to, without the value judgment. Although I think that as individuals, I hope to see our community vaccinated, and I am guessing that you too, Sam and Sam. So Samantha and Sam. So that was a little parenthesis. I'm going to close that. I'm going to ask the practical question. So we are currently vaccinating people, and I was wondering a few things. First, what vaccines are we using? I understand that there are multiple that have been authorized, and what is the difference between them, and whether individuals who come to get their vaccine have any say in which one they are getting.
Mm-hmm. Yeah, so the FDA did approve emergency authorization to use 2 vaccines currently. So Pfizer vaccine and Moderna. And I have a general understanding of these vaccines, but I would encourage people to go to our website to vaccine information, and there is more information on the safety, effectiveness, and information about these different vaccines. And I believe right now, but it probably could change by the day, that we've mostly had Moderna. One of the vaccines requires really very cold storage, and the other one is, I believe, frozen and then defrosted and able to be used. So there are some differences in that regard. Otherwise, the specific differences of the makeup of the vaccines, I'm not as privy to.
So say that some people that are listening to us are the kind of people who have done their research and understand the difference between the vaccines and think that one of them is better for them and their particular health conditions and whatnot. Do they get a choice at all?
So not at the moment. That, the supply has been quite limited. And so whatever vaccine we are getting, if people sign up for the appointment, that's the vaccine that they're going to get. But again, we have some questions and answers on our website, and we'll continue to update those, speaking to, always referring folks to their primary care provider or a medical practitioner to answer specific questions about if they have pre-existing conditions or allergies or other issues that they're concerned about, that they should speak to a medical professional.
Good to know. So right now, only a subset of the community is eligible for vaccines. And I'm wondering if you can explain what that is. And we are talking on, what is today's date? It is Tuesday, January 12th. What are we at? So this is true for the recording time. And again, more valid information is on the website of the health department. But where are we at right now?
Yeah, so right now, New York State is making the determination about the eligibility criteria. So whose turn it is, what phase it is to get vaccinated. And so right now, we, over the past few weeks, we've had phase 1A is eligible. People who fall under phase 1A are eligible for vaccine. And as of the past week, people who fall under phase 1B are eligible. And so 1A is what started a few weeks ago, primarily for healthcare workers, especially those at high risk of exposure to the virus. But for the most part, it's all healthcare workers. And a detailed list of that, again, is on our website, or the New York State Department of Health website also has the detailed breakdown of these phases. And then phase 1B, which recently opened up, it really expands to a much larger portion of our population, which is why it's hard, I think, for everyone to accept who is eager to get the vaccine, that this really is going to take multiple weeks for this population to get vaccinated. It's a very large group. And so as of today, New York State has expanded to individuals who are 65 years and older. Yesterday that it was at 75, but now it is at 65. So that expands it that much further. And then it also includes education workers, teachers in pre-K through 12. It includes, let me get my list actually, so I can make sure I include everyone. It includes first responders, which includes a lot of public safety, like fire service and police. It includes childcare providers, corrections personnel. It includes public transit workers, so our bus drivers, airline employees. It includes individuals who are in homeless shelters and working in homeless shelters. It includes some of our frontline essential workers like grocery store workers, and it includes in-person college instructors. So that is a lot of people, especially in the community, who are eligible and meet the criteria to get vaccinated. So it's a lot of people, and it's going to take some time. So.
And this time, do you think of it as weeks or months?
Definitely weeks.
Mm-hmm.
I don't know beyond that.
Yeah.
Since things are changing so quickly, and the supply, a lot is dependent on the vaccine supply, and
of course
that's distributed. Yeah.
Is the vaccine available for people who are within those criteria but do not have health insurance?
So health insurance is not required for the vaccine, to receive the vaccine. Is that what you were asking?
Right. That is actually part of the question.
Okay.
But the other part, and I guess I should qualify this a little more. So a lot of those things that you've described are things that are populations that are somehow monitored is not the right word, but that there are records about them. What about people who are homeless and are not in homeless shelters? People whose medical that don't have regular relationships with a medical provider or a medical agency. I would assume that these people have a higher risk of exposure, and therefore, is there a way for them to get vaccinated even if they don't currently have a relationship with a medical provider?
Yes, they may not. I mean, they may. You don't necessarily need a connection with a medical provider to get a vaccine. And right now, it looks like, based on the guidance, it is individuals who are in a homeless shelter. So there probably will be more defined by the state about others who are homeless or do not have housing. That I think that there's probably more to be defined regarding that.
What is the action step that one needs to take in order to get vaccinated? So say I am 71 today. I'm 75. Say I just had my 75th birthday and I would like to get vaccinated. Where do I go? Is it an online form? Do I call someone? And what would I do if I don't have a regular medical provider?
So if if an individual meets the eligibility criteria, which are the groups I just listed, then the way to register is to go to our health department website, read through the eligibility, and then click on register with the registration link that's there. And that will take you to the New York State registration system. And you would proceed with the questions on there. On the registration, you can also review if any documentation is required for the groups where it's based on their employment status, then they do need to show proof of that employment in order to be eligible. And so those should be reviewed if there's any documentation needed. But like I said before, the health insurance is not required, but if you do have health insurance, you should bring your health insurance card to the vaccination site. There's no copay or fee for the vaccine. And I already mentioned that residency is not required, or you're not limited by where you live. So you would proceed through the registration, and then I believe there's an attestation, I believe, and a registration confirmation that you'll get.
What is an attestation?
So an attestation would be confirming that you're eligible for this phase. And so there were attestations for businesses when they reopened after the shutdown, that they had to have like a safety plan in place and be taking precautions before they reopened. And they had to sign something online with the state that attested that showed that they were abiding by those precautions.
Thank you for explaining. It's a new vocabulary word for me.
And I'm realizing that the term for the registration might actually be affirmation versus attestation.
So is that something that asks people a question and then relies on their honest answer and asks them to confirm that their answer is honest, or does it also require additional documentation?
I'm not sure on the details of that, but it's a good question, and maybe something that we should further explain on our website about that process. So I'll look into that, and
Thank you.
We'll further explain that because I'm not sure about those details.
I can actually interject right there because I've been getting the same question. So I know that when you go, they definitely want your ID and your insurance card if you have it, but the pay stub, employee ID, or letter from your employer, plus the affirmation is really, my understanding, is all you need to get through.
Yep.
Okay. A question about university teachers. Cornell has been doing a lot with their own resources when it comes to our community health during this pandemic. And I'm wondering, and I am just not knowledgeable about what other universities in our area are doing. But are professors and other people with higher risk of exposure in the universities going through Cayuga Health System, or are we expecting to see the universities providing vaccines directly?
Yeah, that's a good question. I don't know the answer. I think that Cornell and IC, Ithaca College have also been really important partners throughout the pandemic with the health department, and they've partnered with Cayuga Health System as well. So yeah, I don't know how things will progress in terms of the vaccine distribution, but I'm sure planning is underway and conversations are happening. But But again, some of it will be based on that vaccine supply too. That at this moment, we just have this one site in our county to make sure that that it's as efficient and effective at getting as many people vaccinated as possible. And so that's the current setup. But again, that can definitely change over time.
It's really remarkable how this is, a trying time of unprecedented challenges and having to sort of build the plane while flying it and figuring out how to fly in formation, not how to fly information. That would be interesting to see information flying. But there's just so many things that need to be coordinated and things that have never been tried before. And that in itself is somewhat dizzying for us, the health consumers, and I'm sure it is for the university and school administrators, et cetera. So just a moment of, recognizing that this is just hard and complex. And of course, all of this will take time and is baffling for a while. And not all of it makes sense to us. And we're also dealing with the situation in the United States, just the way the health systems are built with private insurance, and how when people move between jobs, there is a discontinuity between their insurance, which sometimes can lead to discontinuity just in their health data. And this is interesting to note, and I have a view of what's going on in a different country. I'm originally from Israel. My family is still there. I moved to the United States when I was 21. And the healthcare system in Israel is vastly different from here in the sense that it is it's a national healthcare system, but people do have choices. So for a greatly simplified way of explaining this is that there is 3 kinds of Medicare, and it is Medicare for all, but you get to choose which of those options is best for you based on, your preferences and your, various conditions that you might have. But most people stay with whichever agency, I guess I'll call it, that they have signed up with. And and usually it's a choice that they make where, their parents make for them when they're children. And very often they will stay with that throughout their lives. And if they switch, they'll switch when they become, grown-ups, but they'll stay within the same sort of information system for a very long time. So there's, long-term continuity of the information of individuals. Your own medical data has been sort of in the same place under the same authority forever. And also there is, continuity and just a lot of, the state, the country is able to have a very good view of the health situation of most of its citizens. Mm-hmm. So that means that Israel has been able to roll out vaccine in record speed because it's much easier to do when it's centralized. Mm-hmm. And over the past month, my entire family has been vaccinated. If they were age eligible for the vaccine, and I'm not saying if they're old enough to get it, as in like elderly, a 14-year-old didn't get it, but the 17 and 18-year-olds did get it. Mm-hmm. But it's not that the vaccination efforts are finished there. But they were doing this interesting thing where everybody who's currently sort of state eligible in terms of their elderly status or health conditions are, and their risk of exposure because of their line of work, etc. All of those things were able to get vaccinated. We're eligible to get vaccinated first. But then they had this system where, because every day they opened a certain number of vaccines and there's always some no-shows, they've had this system where they've informed people how to get in line for a same-day vaccine when it became available, even if they were at a group that is supposed to be vaccinated later, if they showed up in the parking lot, they had a way of informing the people inside that they are here. And if there's available vaccines, they got to get them, sort of jump the line in a way that isn't stealing a vaccine, but in a way that is using available vaccines just to the max. And I'm wondering if that sort of thing is being considered. Is it made available? Is this something that is even a need, because it could be that there aren't any leftover vaccines. But I think I'm kind of getting lost with asking this question effectively, but I see in your eyes that you get it. So I'm going to pass the mic back to you.
So yeah, that's really interesting. Thank you for sharing about your family in Israel. I think that, like you said, this whole pandemic has been really an unprecedented time, with information changing so quickly, and so many moving parts that, I think this next phase used broadly of the vaccine distribution, we're also going to continue to be learning. It's very, large scale administration that needs to happen. And so it really is unprecedented. So I think we'll continue to borrow and draw from best practices that are being used other places. We have really smart people and really, amazing partnerships that are happening in our community that are really leading the way as a model for the state, that over the past week and a half, we've administered a lot of vaccine, and it's going really well and really smoothly. And so I think that in itself is such a huge win and success that we've set the standard high to continue that process. And again, that's not to diminish that people are frustrated about getting an appointment right now, and that the state system goes down, and there's a lot. It's just the sheer volume of people trying to get an appointment, which is encouraging because people are eager to get the vaccine, but also, so there are these glitches along the way, but again, that will continue to get more vaccines. So I think that right now we are using up the vaccine. There are pharmacists, I believe, or medical professionals at Cayuga Health System who are carefully monitoring our vaccine allotment and the doses that we have available, so that no vaccine is wasted. And that's being very firmly discussed at the state level. People are on the governor's press conferences, and that they don't want any vaccination wasted. So we are taking that really seriously and to heart here in Tompkins County, that if there are additional vaccine doses left over after the scheduled clinics, we will move fast and work hard to schedule another clinic. And so right now appointments are required. So it really, based on how many doses we have, we will open up additional slots. So that's how it's working currently. But again, like I've said probably a few times during this time with you, that things just change so rapidly. And again, as the vaccine supply increases, things will continue to change too.
It is I think it's heartening how responsive all of this is. And so, again, wonder and gratitude at all the good work that you guys are doing, and appreciation for how hard you're all working. So we have actually covered all of the questions that I had written down. Some of them are my own questions. Some of them I got from other mamas, and some of them came from my children. So thank you so much for answering my questions. I just wanted to give you the mic back before we head out to see if there's anything else that you would like to tell us that we haven't touched on.
So I think one thing I wanted to touch on earlier was that as new and novel, and as quickly as things are changing through this pandemic, that for this vaccine distribution, public health has been, local health departments and the larger public health community has been working on this tool that we have called points of dispensing, pods, for many years, and that is the way of getting out mass vaccination or mass amounts of antibiotic, for example, if needed. And so this system has been practiced and prepared for many years, and it's really being put into place at this moment in time. So that's why here in Tompkins County and other places, I mean, that these vaccination sites are being set up and they are running as smoothly as they can when systems are working. But that's something I want to share. And then the other big piece is that while this process of vaccinating the population is continuing, we need to remember that it's going to take some time, and that we need everyone to continue to follow the COVID-19 precautions that we've been talking about for months, that people need to continue wearing their mask, washing hands, maintaining distance from others who are not in their household. And so all those pieces need to continue because we have a lot more people to vaccinate before we have that protective community immunity to this virus. And so I just want to stress that those things that have become quite normal to us now need to continue.
Right. Well, as mothers, we've been telling our brood to wash their hands forever. Now, finally, the rest of the community has to listen to this request. Yeah, although, we have not had to tell people to wear their mask until now. So I am just so grateful that we were able to do this together. Sam Lushtak, thank you so much for hosting us and giving us, your platform at Absolute EHS, which stands for Environmental Health and Safety. As always, it's a pleasure to spend time with you. It is 3 minutes before I have to log into a telehealth appointment where I am seeing my therapist. Thank goodness for, mental health being able to be provided without, adding risk of exposure. So I just wanted to state that just as a matter of normalizing getting help. Yes. So thank you again. And I'll pass the mic back to Sam Lushtak.
All right. Thanks, Yael. Thanks for hosting. So Sam, we can do a Sam squared thing. I have 3 questions on behalf of a variety of clients that I think you might be able to answer. And, sometimes it's better if it comes from someone that's not me. So you talked about attestations and affirmations earlier. Tompkins County is full of self-employed people. And a lot of people, strangely enough, started businesses during the pandemic, so they might not have their tax returns or any equivalent of a pay stub. Is just a simple letter on their own behalf going to suffice for that affirmation?
That's a good question. And I think it's also something that perhaps we should add to our FAQ on our website about those who are self-employed and what documentation they may need. So I will look into that and we'll get an answer for you.
Okay, great. And then there are 2 more questions. So we talked about pods. I happen to be one of those Medical Reserve Corps people and MRC, and I love doing pods. It's actually something I've been doing for a few years now. So there was a call for MRC volunteers, and originally they weren't offered a vaccine, and then they were, which is great. But one of the questions a lot of people have is, once you get your second dose and you wait 2 weeks, you're supposed to be protected, but can you still spread COVID?
Good question also. I believe that there just isn't enough data or research that has been done yet to really understand if once you have, both vaccines, if you can still then transmit the virus. So I don't have a definite answer on that, because I think the hope would be that you can't, but I don't think there's been enough research done on it yet.
Great. And I mean, frankly, I know I've been advising everybody, get vaccinated and then go back home and put your mask back on, because, you know, we need herd immunity anyways, and we're nowhere close. And then the final question for Tompkins County Health Department in particular, you made comments indicating that we're using up the vaccine and distributing it appropriately and efficiently and as quickly as possible. Are we withholding half the vaccine to ensure that everybody gets their second dose within that 3 to 4 week period, depending, or are we assuming we're going to have more vaccine dispatched within the correct amount of time?
Yeah, so we are not holding back vaccine. I have heard that that's was considered or being done other places, but we are not doing that. And yes, with the plan that we will be getting those second doses. Yeah.
Great.
So, yeah.
Okay. Oh, and then of course there's that like last question, just to keep you on a little longer. So with the registration, you get your initial appointment. Are you then put into a system and alerted to your second appointment, or is there another mad scramble for your second appointment?
No, when you go to the vaccination site for your initial shot, then before you leave, at least if all things are working properly, before you leave, you are registered and signed up for your second dose, and you're given a vaccine card at the site that writes down the date of your first vaccine, and it also records the planned date for your second, which is about a month apart. And then there may be other alerts though as well, but I know that you're registered for that second dose before you leave.
Awesome. Well, that's all I've got. You've been very thorough.
Okay.
So, thank you so much for your time today.
All right. Thanks for hosting, Sam.
Of course. Be safe.
You too.